mechanical alignment may lead to patellofemoral problems. And in this section, we'll show that its use does not explain patellofemoral instability after kinematic alignment. An in vivo study performed in our lab showed that kinematically aligned TKA restores the physiologic patellofemoral biomechanics in the sagittal plane during a deep knee bend, and this was done in vivo on 25 patients with a total knee on one side and a native or normal knee on the other. Kinematic alignment with the CR component, in this case a Persona brand, largely restored the proximal distal patellar contact locations, which at most differed 10% from the native contralateral knee. In this cadaveric study, the kinematic alignment of the total knee arthroplasty led to a better restoration of patellofemoral kinematics compared to mechanical alignment. Kinematic alignment with a CR PFC sigma restored patellar kinematics closer to that of the native knee. And here you can see one dependent variable that was assessed, the medial lateral shift of the patella during motion on the x-axis from 0 to 90 degrees, and the shift measured in millimeters on the y-axis. And you can see the native curve, the kinematic alignment curve almost superimposed, and there's the mechanical alignment curve. Why is that off when the implant is designed for use with mechanical alignment? It's because there's a change in the Q angle, as we'll discuss in a moment. In another cadaveric study from a different research group, kinematically aligned TK more closely reproduced the native patellofemoral biomechanics than mechanical alignment during a deep knee flexion. And you can see their testing rig with an Instron machine, and they were able to instrument the patella button. This study, using a CR LOSPA implant made in Korea, better restored patella kinematics and patellofemoral contact pressure closer to the native knee than mechanical alignment, and they opined that this explains why kinematic alignment patients experience a more normal feeling knee than those with mechanical alignment total knee arthroplasties. The reason that kinematic alignment works with femoral components designed for use with mechanical alignment is because kinematic alignment restores, whereas mechanical alignment malaligns the native Q angle. So 70% of our patients have some form of constitutional varus, and here's an example of the Q angle in such a patient. When mechanical alignment is performed and the distal femoral joint line is cut perpendicular to the mechanical axis of the femur, and the same is done on the tibial side, the Q angle is markedly increased. Hence, this changes patellofemoral tracking. However, the opposite knee in this patient has a varus deformity, and when we do kinematic alignment, we restore the native joint lines of the femur and tibia, and hence the native Q angle is restored, which then allows the retinacular ligaments to maintain their native resting length and allows the patella to move within the trochlear groove in a more native way.